God. Okay. Um, Good afternoon. Today we are doing the Trusted Messenger or the Community Connector interview with Ladan Abdi, who is a program manager at Somali Health Board. And this Community Connector interview is part of the COVID-19 outreach and engagement project that Eastside Baby Corner is doing in collaboration with Seattle King County Public Health. So thank you so much, Ladan, for your time this afternoon. And I would be asking you a few questions. This is more to understand the attitudes and perceptions around COVID-19 and COVID-19 vaccinations among the population that Somali Health Board serves. I'm really thankful for your time. And let's start with this conversation. So to begin with, tell us about yourself and your position.
Thank you so much for having me, Ruchi. My name is Ladan Abdi. I am a program manager at Somali Health Board. I manage the Somali Centering Motherhood program. I can tell you a little bit about that program. It's a culturally responsive prenatal 0 to 5 years old home-based program, and it's an evidence-based program. It's includes centering pregnancy and centering parenting. So we have the centering part for pregnant moms, and we also have the centering part for parents that have children from ages 0 to 5. And it's our aim is to engage and serve and improve the health outcomes for Somali moms and babies here in Washington, specifically King County, and to promote healthy lifestyles and encourage early prenatal life health. Were you able to? I think that's how much I'm really proud of that program, and that's the one that I manage.
That's great. So tell me more about the community that you serve. You did mention about the Somali moms that you help through your program, but overall, in general, when we talk about your organization, could you talk more about the community that you serve?
Yes. So Somali Health Board serves communities here, the Somali community here in King County, and we serve all types of Somali, all of the Somali communities in the King County area. So we have programs for all of the ages, whether it's seniors, mothers, children, kids, and currently we do have a COVID response as well program. We serve low income relatively. Some of them are immigrants, some of them are refugees. It's a mixture of everything. As long as you're Somali and you live in King County, you do qualify for our programs, and you are from a lower income background.
Wow, that's great. That's a lot of population throughout the county that you serve. That's excellent.
We try to reach as many as we can.
Yeah. To start with, talking about the pandemic and the vaccinations and stuff, it would be definitely helpful to understand how COVID-19 has affected your community through the course of pandemic.
Yes. So I think COVID-19 had a huge impact, whether it's the mental health of the families that we serve. I think it's something, when you say it's pandemic, it's something that the whole world is going through with us. And I think that's one thing that we can say, like, everyone was affected in some way. I think for us as an organization, as a relatively not very big organization, we couldn't put a hold of our programs because our families needed it really very much. So what we did was, as many people did, we moved our programs to virtually. So let's say we have home visits. Instead of going to the house, we would call the parents. And I think Eastside Baby Corner has been a great help in delivering basic needs like diapers and formulas to our families. And that we have also continued. And I think one thing we have changed was move our services virtual instead of going to people's houses or having them come to the office. They do sometimes come to the office when we do deliveries, but we try to keep it as safe, like a safe distance, wear mask and take the precautions as needed.
Yeah. How do you think the introduction of COVID-19 vaccines has affected the community?
I think initially, just like many people, to be honest, we didn't know. Our community is not well versed, or like to say the least, they're not, most of them are not really educated, or they don't understand the healthcare system or the American healthcare system. And I think they were initially they were hesitant, and we did see this because we were helping people to come and get the vaccines. They were hesitant. They're like, we don't know what's happening, and there's also the lack of trust in the healthcare system, and we did see that. And another huge part was there was a lot of information there, not necessarily the right information. First, we didn't have information, and then when we actually had the right information, there was other information that was going around that our families would come and ask us, oh, is this true? You know, if you take the vaccine, would this happen? And then like for us, we do have the right information that we can compare to, but for someone who's their only source of income, their only source of information is not necessarily the right information, I think they could really be misguided. And that's one thing that we saw. There was a lot of misinformation going around about the vaccine, and that made our community really hesitant in getting vaccinated. I think as people went on and a lot of people got the vaccine and we saw the results, that nothing happened to them. No, they weren't dying on the streets, or like they were not turning into zombies. I think they were more willing to get vaccinated. I think with the right information and with the right approach, they were able to assess and see that, you know, this is actually science, is not going to harm you in any way. They're able to come to the terms with getting the vaccine. And I think we have seen more people getting vaccinated than initially when the vaccine came out.
Mm-hmm. Wow, that is really true about, you know, the information, misinformation, and the vaccine hesitancy, and which affected a lot when it comes to people getting vaccinated. So this is good information that you are also putting in a lot of efforts in working through the hesitancy and making sure that more and more people are getting vaccinated. That's great. Do you think most people in your community would be willing to get vaccinated if it was easily available?
Absolutely. I think yes. And with the right approach. If it was easily I think vaccines are, if they do think this is the right thing that they have to get, which I think they do now, and if it's easily accessible to them, they would absolutely get it.
Mm-hmm. Vaccine availability is a main game changer as well. I mean, when you're trying to work through the educational piece and motivating people to get vaccinated, the next step is whether the vaccines are available. So,
absolutely.
Yeah. What do you think are the main reasons for the people in your community who may want to get vaccinated?
What would be the most, sorry, say that again?
So what do you feel are the main reasons people in your
Right.
community would want to get vaccinated?
Yes. I think one of the main reasons is to protect their loved ones. I think once when the COVID happened, a lot of people lost family members, the people they loved. I think that's a great factor in like protecting people that you love or people you care about. You don't want anyone to die of COVID, and we have seen the impact of COVID. That is one of the biggest factors, and also just being part of society and like playing your part in a society. I think that drives me, and I'm pretty sure it drives a lot of people in my community to get vaccinated.
Yeah. There's a lot of information about the vaccines right now. As you said, initially, we did not have information, then we started getting the information.
Mhm.
What you have heard about the COVID-19 vaccines from the source you trust?
From the source that I trust, I usually I think for me it's easier because I am working in a professional setting. I am from a academic background. It's kind of easier for me to get the right information, whether it's like going to the King County website or going to our website. I think the challenge is to get to get information to our families who who wouldn't think of going to the website, or who do have other sources, whether it's like a group chat that they're on and they're getting some information out of Facebook post that's not accurate. I think that has been our biggest challenge, and what we have done was try to create an informational session for our families to combat those myths and those misinformations, because I think they are still out there, and we try to give them the right information. I think with if you like, for example, the resources that you'll be providing, hopefully we want to give them those and like help them understand that, this is whatever is out there is not true. And so when they see these things, they're like, oh, this is probably the right information. And or they can compare the two information, even like it doesn't matter if, as long as you have it, as long as you can access it, you can see it for yourself, I think.
How easy do you think it would be for the people in your community to get a COVID-19 vaccine if they wanted one?
We do give vaccines in our organization.
Mm-hmm.
Somali Health Board organization does provide clinics where we give vaccines, and we try to go as many places in King County as possible. And we also have, in our page, we have a resource guide where they can access other locations as well if they're looking for a place where they can get vaccines, or if they call our office, we do guide them, and we do give them options, like wherever they are, we try to find places around them that has that's giving vaccines.
Mm-hmm. That's great. So, which means that you yourself as an organization has a pop-up vaccination clinic wherein people can come and get vaccinated. And if they want to go any other place, then you would have resources for them. That's
Right.
great. Are there any key barriers that people in your community are likely to face if they went out to get the COVID vaccine? Like, for example, now, if they are not getting vaccinated at your program location, if they choose to go any other location which you would have information about, are there any key barriers that people would face there?
I think the key barrier would probably be language, just trying to communicate with the people that are there, or like understanding instructions or where to go. Because once I was getting vaccinated, I think there is a way where when you come in, you have to get your insurance, you have to answer some questions, and then, or not a lot of questions, but there's a procedure where you go through. I think that could be an obstacle. If they feel like, oh, I don't understand anything, or if they don't understand what's going on, I think that could be something that they could create, like hesitancy or some sort of apprehension.
Mm-hmm. Yeah. I know you talked a lot about the efforts that are being taken by your organization, Somali Health Board. So along with those and apart from those, how do you think your organization can help folks understand the benefits of vaccination and access to vaccines?
I think we try to share on Facebook videos and more information. I think what we can do is probably provide more resources. I think that's one of the reasons why when you contacted me, I was like, this is a very good opportunity, because we don't have that tangible information that we can give to them and they can use, and also like hopefully share with other community members,
Right.
that their neighbors or like someone else that they know that's not part of our our programs or our organization. I think that's one thing that we can absolutely do better, is have more materials to provide, like kids, as you said, so that they could take home. And the hope is hopefully that they share with
Mhm.
other people as well.
Yeah. Yeah. Great. I'm really happy that the resources that we can provide you would be helpful in reaching out more community members, in
Yeah.
addressing any hesitancy or giving them more scientific and accurate information. What can our local health department do to help the community get vaccinated,
I
apart
think,
from whatever is going on
yeah,
right now?
apart from what's going on. No, that's true. I think more education and transparency with with the people that have actually taken the vaccine is
Mhm.
showing results, I would say.
Mm-hmm.
And that actually helps, because now that we are vaccinating little children and kids, we see a lot of the same things that we saw when adults were getting vaccinated. They're
Mm-hmm.
more hesitant initially, but the more children that get vaccinated and they see that they're actually healthy, or there's nothing happening to them, they're more likely to get it. Um, I think that's one thing that we are facing currently, because we are doing children vaccinations and we don't see a lot of people from our community vaccinating their children. And we do understand the hesitancy, and we're trying to get them to get the right information, the right tools, so that they make the right decision, hopefully,
Yeah.
what they think is
So
good for them.
this was a very good point that you brought up about vaccinating children. And
Mhm.
I basically wanted to ask, my next question was, what are you seeing in the community as far as getting kids vaccinated? Because I know we had vaccinations for adults for a long time, and
Yeah.
now we are trying to push for getting children vaccinated, right? So what are you seeing in the community, like for the people who are getting their kids to get vaccinated?
Mhm.
What is the motivation for them?
Um, I think one thing that I hear the most is, oh, I want my child to be healthy, or like I want them to be able to go to school, because they are going back to school. They are doing a lot of activities, and they want them to be able to take part in those activities, and they want them to be protected in some way, because the virus is still there and it's still highly communicable. Um, it's very easily spread. I think those people actually have the right information. Most of them, when they come there, they know, like, oh, this is actually going to help my child, my family in the long run. That's why I'm getting them vaccinated.
That's great. And could you also talk about if you have come across families where they are still hesitant to get their kids vaccinated? So, what is that hesitancy, and how are you trying to navigate through that?
Yes, we have come across a lot of them, and I think one of the main concern is they don't know what the vaccine is going to do to their children. I think
Mhm.
there's still that misinformation in the back of their head, like vaccines can cause harm in some sense, um, which we know that that's not the case. I think they're still just testing out the waters, seeing how people are when they get the vaccine, or how they're not. Like, just seeing. I think it's a new thing, and you do expect people to be hesitant. But I hope, but we try to tell them, like, okay, this is something that we did for our families, and if it was harmful, we wouldn't be encouraging you to do it. I think we did build that rapport, or like that trust with our families. Hopefully that when we do provide these things, that they do listen to us, and they do try and at least like consider, or like, that's why, again, coming back to your kids, I think that would really help them. That would really help them, like, to just see, or hopefully even like consider.
Mhm. Mhm. Yeah. Yeah, that is so true, and that is so critical. Do you also see the hesitancy among, they hearing about the side effects or something like that? How are they dealing with the side effect aspect of the vaccines?
Um, I think most of the adults are vaccinated, so they do know the side effects and they have seen it. Most of them. With children, I'm not sure how they haven't talked about any side effects or anything of that sort. But they as adults, I think we kind of know when we're getting the vaccine. Oh, this might happen. Don't. I think they do tell you when you're getting the vaccine. Oh, don't take this medication. Like take it after 2 hours or something like that. Most of them, since most of them are vaccinated, they might know about that as well. And they are better. I think they are better if you are vaccinated as a parent. I think you are better able to prepare your child once you are vaccinating them. And
And and when you say that a lot of adults have already gotten vaccinated, are you referring to them getting both the doses and also the booster?
just the 2 doses from what I know.
Yes, yes. So is there some more effort that you have to put in to make sure that they also get the booster dose?
Yes, we are trying to do the same thing that we did initially with the vaccines. Have provide more information, have videos, or like go to other community places like the mosques or like schools even to like encourage people to come and get the booster, and just to let them know that this is like just like you got the vaccine, this is also a step in the right direction in like fighting the COVID, the virus.
Yeah, yeah. Great. I know you are taking so many efforts in working through the pandemic and the fight against the pandemic, also
Yes.
motivating community members to get vaccinated. I also know that you have so many events that are going on,
Yes.
and the organization is putting a lot of efforts in reaching more community members and working through this piece. Could you share more about the events that Somali Health Board is hosting, and what are these events, and who can come? Is it only for specific community, or is it open for all?
um well, it's actually open for all. We try to convince actually our COVID events are getting people vaccinated. Initially we were doing adults. I think they are still doing adults, but now it's more geared towards children. They go to schools, after school programs, or any other places that are easily accessible, like wherever the children are, that's where we are. That's where we're getting them vaccinated. um, what are the efforts that we're doing?
So this is what you're doing basically, like
Yes.
with the events, and you also have a specific COVID team, right?
Yes, correct. Yeah, we do have a COVID response team. Our team are the ones that do the events for the COVID. So what they do is they get people, they set up clinics where they have a vaccine, where they have vaccines available. Um, yeah, I think the COVID team are doing a lot with um, trying to get people, trying to make vaccines as accessible as possible. Or that's why we have a lot of events, even like 2 events at the same time, running at the same time, just to make sure that we are very flexible in our time and also in our locations as well.
Right. So, how would any other community member would know about these events? Where is the advertising happening for these events?
Yes, I think one place is our website, the Somali Health Board website, and the other one is our Facebook page. Those are, I think those are the 2 places that I know of where we can find the information on.
Okay, that's great. Yeah, I just wanted to wanted you to share more about the events, because I know I got a long list of
Yes.
these events where we would be doing some more outreach with you, right?
Yeah.
So yeah, this is great. Any other thing that you would like to share?
I think I'm really excited to see the kits and everything that you will be delivering this week. And you have been a great help in our response to COVID, whether it's continue providing for our families, and like also having a COVID, as like other families that are actually not our part of our program get the help as well. I think that has been a great help for them.
Oh, that's great. And this is more like a mutual partnership that we have. So, I mean, since we do not directly work with the families, having you as the point of contact, the connection with the families is very, very helpful. And that's the reason why I wanted to invite you to talk about your community and how your organization is navigating through the pandemic and the vaccines for your community members. So thank you so much for your time this afternoon. It was lovely chatting with you. And also on behalf of the kids and families in the community, we would like to thank you for your efforts, and wish you luck to continue with more efforts in doing what you're doing. So thank you so much.
Of course, thank you so much. Pleasure is all mine.